Hello, how are you? Good, how are you?
Are you free, doctor?
Yo, I just finished the implant case. Yes, tell me.
Implant isn't a new way of replacing tooth.
Actually, implant has been there for many years. It's been more than 25 years. It's just recently people have started taking importance to it.
Can you please tell me about it? I also have a missing tooth to be replaced.
Oh, sure. Come to my room. I'll tell you better. Now, the only thing that we require for a good implant to be placed is good bone. So if you have good bone, we can place an implant. Now, what is an implant? Right? Now, the implant has three structures. One is the titanium one that is placed inside. This can be also zirconium, which is actually the new trend now, but mostly used is the titanium implant. And then you have a superstructure, which is called the abutment, and crown, which is placed on top of that. The crown can be either the crown which is placed on that. The crown can either be porcelain or it can be zircon. It depends on the variety. This is basically what an implant is. The the permutation and combination of placing the implant depends on how many teeth you need, how is the bone structure, and everything else. So the basic thing before we place an implant is to know whether your health is good.